Let's start by talking about what sleep apnea is. There are many different kinds of sleep apnea. The kind that we're going to talk about today is the most common type, which is obstructive sleep apnea, or OSA. Apnea just means you have trouble breathing. Sleep apnea means that this occurs while you sleep, because obviously when you're awake you don't even think about breathing. And obstructive means it's not necessarily a problem of your brain or your heart or your lungs. It's an obstruction or a barrier from getting air into your lungs when you sleep at night. And that barrier or blockage occurs in the back of the throat. So when you're awake, there's muscle tone that keeps the airway open. This allows air to filter through the nose, down the back of the throat, and into our lungs. But when we sleep, we relax all of the muscles in our body, including the muscles in our throat, so there's a relative collapse. This causes a very narrow opening to occur, so the chest and belly muscles have to work harder to bring that air in. But because it's soft tissue, at some point it acts like a suction, it closes that airway, and that causes the apnea or the obstruction in the breathing. Then the brain senses the relative drop in breathing, the relative drop in oxygen levels, wakes you up briefly to open up the airway, and then allows suctioning of air back into the body. There are several symptoms associated with sleep apnea. When the blockage of the area of the throat occurs, the most typical symptom is snoring. Snoring is just the sound of air being dragged past a narrow windpipe that causes a vibration type of sound. Pauses in breathing, or apneas, occur when the pressure suctions the airway inward and collapse occurs. So sometimes people feel gasping or choking during sleep, and other people don't notice it at all. It might be witnessed by a bed partner. Frequent bathroom trips can occur, which isn't necessarily due to a bladder or prostate issue. More likely something wakes you up, like a pause in breathing. The bladder contracts and makes you feel like you have to use the restroom. Others describe poor sleep quality or unrefreshing sleep. And the body may also clue you into low oxygen levels by giving you headaches or muscle aches and pains or palpitations. High blood pressure readings and higher sugar level readings have also been observed with sleep apnea. And overall, you might feel fatigue or sleepiness.